Today I wanted to talk a little bit about Ebola, as Ebola is a frightening and new virus to the U.S., so it is understandable why there's some widespread anxiety here in Lake County. Here are some things to help put the handful of Ebola cases diagnosed in America in perspective, and I wanted to tell you what Lake County is doing to minimize the risk. Just as a reminder, Ebola is spread by direct contact with body fluids. It is not spread through the air the way influenza is. If it were, there would be millions of cases of Ebola throughout Africa, just as there are tens of millions of flu cases in this country every year. Patients with Ebola are not infectious until they have symptoms. Every single Ebola outbreak in Africa over the last 40 years has been brought under control with standard infectious disease measures that we commonly use in Lake County. Basically, we want to isolate the infected patients and track down who their contacts are. We are working very closely with the Illinois Department of Public Health and the CDC to make sure that we have the most up-to-date and complete information on how to combat Ebola. And we have sent this information to our local schools, hospitals, medical providers, and our other partners. We are also collaborating with our regional health departments, as it may involve many of us, especially if the case arrives in Chicago. So based on conversations and meetings with hospitals in Lake County, we and they aren't assuming that they're more prepared than the hospital in Dallas. That's why they're practicing what to do if an infected patient walks into their emergency room, and we are practicing what we would do if an individual case came into our clinics. With that being said, we're working with fire chiefs and emergency medical services personnel to assure that the dispatchers of 911 are asking the right questions when there is a call, so that staff are prepared and properly protected when they transport individuals to the appropriate hospitals for treatment. Additionally, we are working with the Sheriff's Department and other municipal law enforcement to assure that we can appropriately quarantine those that have had contact with an infected individual. If an individual does not voluntarily agree to quarantine, we have spoken with the judges so that when we request a court order from them, that they understand why it's needed to protect the public. For those individuals who may have to be quarantined, we are working with entities such as the Red Cross to assure that there is a provision of adequate food, clothing, shelter, and medical care while they are being monitored by our communicable disease staff. If you have further questions or concerns about Ebola, you can call the IDPH Ebola hotline 24 hours a day at 1-800-889-3931. Again, that 24-hour-a-day hotline number is 1-800-889-3931.